Share on Pinterest things to consider periodically. Lumps develop in or around the vagina. There are a variety of causes for these bumps, including vaginal cysts, genital warts, pressure from an adjacent organ, vaginal skin tags, vaginal angiomyxoma, vaginal cancer. If you discover a lump on your vaginal wall, make an appointment with a doctor or other healthcare provider. They can help you identify the cause and, if necessary, develop and help you follow a treatment plan. Keep reading to learn more about possible causes of lumps or bumps you may notice in this area. Vaginal cysts found on or under the lining of the vagina. Vaginal cysts are closed pockets of fluid. The types of vaginal cysts include vaginal inclusion cysts. These are caused by injury to the vaginal wall and are the most common vaginal cysts. Bartholin's cyst. This type is caused by fluid backup in the Bartholin's gland located near the vaginal opening. Gartner's duct cyst. These are caused by fluid accumulation in the vestigial Gartner's duct. Cysts often stay small and don't need to be treated. Your doctor will monitor the cyst, watching for changes. In some cases, cysts need to be drained, biopsied, or removed. If there's an infection, your doctor might prescribe antibiotics. Genital warts. Genital warts are caused by human papillomavirus, HPV, infection and spread by sexual contact. Genital warts may also be painless, small, less than half the size of a pencil eraser, found in clusters found inside or outside the vagina, sometimes around the anus. Pressure from an adjacent organ. A lump or bulge in the vagina could be caused by an adjacent organ that has moved from its typical position. Usually, the uterus, rectum, and bladder don't press against the vaginal wall. With age, ligaments holding organs in place and muscles in the pelvic floor can weaken. If an organ loses enough of its support, it can move from its typical position. Press against the vaginal canal, and create a bulge in the vaginal wall. If it's from the uterus, the bulge is called a uterine prolapse. If it's from the rectum, the bulge is called a rectocele. If it's from the bladder, the bulge is called a cystocele or bladder prolapse. Vaginal skin tags. Vaginal skin tags are also referred to as vaginal polyps. According to the University of Iowa, vaginal polyps aren't harmful and treatment is unnecessary unless they bleed or become painful. In rare cases, an angiomyxoma. An angiomyxoma is a slow-growing type of tumor usually found in the female perineal and pelvic areas. According to a 2013 case report, this type of tumor is rare and sometimes overlooked when diagnosing a lump in the vagina. Typically, treatment involves surgical excision of the tumor. In rare cases, vaginal cancer. Mayo Clinic indicates that a lump or mass in your vagina can be one of the signs of vaginal cancer. Although there are often very few symptoms in the early stages of vaginal cancer, as the disease progresses, other symptoms may include watery vaginal discharge, unusual vaginal bleeding, pelvic pain, frequent urination, painful urination, constipation. According to the American Society of Clinical Oncology, ASCO, vaginal cancer is rare, occurring in about 1 out of every 1,100 individuals who have a vulva. About 75% of vaginal cancers are due to HPV. The bottom line: if you discover a lump in your vagina, it could be a symptom of genital warts, pressure from an adjacent organ, vaginal angiomyxoma, vaginal cysts, vaginal skin tags, or polyps. Vaginal cancer. If you find a bump or lump in your vagina, speak with a doctor or other provider. They can help determine the cause and work with you on a treatment plan if necessary.